On the press conference, the experts identified 4 hypotheses for the source of the transmission of the novel coronavirus to the human population. The joint study said that a laboratory incident is extremely unlikely as the cause of COVID-19, and introduction through an intermediary host species is the most likely pathway. Direct transmission or introduction through cold chain food is also likely.
We are still working with the hypothesis that it could have been introduced by a person who was infected and then spread it to other person in the market. That could be one of the traders, it could be a visitor, but it could also be through the introduction of a product.
Among the outcomes of the joint study, a coronavirus with high similarity to the novel coronavirus in gene sequences occurs in bats and pangolins. But similarity is still not enough to make it a direct ancestor of the novel coronavirus. A study also showed that as there were novel coronavirus cases in Wuhan market, there were also such cases in other areas of Wuhan at the same time.
We have conducted PCR testing for 26,800 samples generated from different kinds of animals that are distributed in 24 provinces in China. The PCR testing results were all negative.
And also back in 2019, it doesn't look like there was wide circulation of the virus in any animal species in the country.
The team studied a massive amount of epidemic-related data and visited 9 facilities. They also interviewed social workers, community workers, residents, recovered patients, and families of medical workers who lost their lives in the epidemic.
We wanted to move away from, I think this is it this way, or I believe it is this way, and try to move away from that and put rational and facts on the table that everybody can then look in a systematic way. We felt that that was a much more useful approach than to put personal views, feelings, etc., or looking at only half of the arguments.
So it is an entry point for a trace back investigation, because that's the step that we're now looking for. We have a deeper understanding of the early situation. Where would you go for a next step of these origin studies?
WHO experts said future studies into the origin of the viruses will head wherever indicated and not be geographically bound.